Yeah, so it's challenging as a practitioner, talking to people. Like the kid that I just recently got this week is so, I do this 7 a.m. Zoom call, and I'm doing this Zoom call, and as I'm talking to this kid, and his dad, I look above on the ceiling tile and I see water spots. And I'm like looking at this stuff and I'm like, there's black in some of this stuff. And I'm like, those water spots, actually, people can call it mildew, you can call it
Oh,
mold.
mildew. That's the cute. That's a cutesy name for mold. If you're calling I would say like someone with my mom would say, "Oh, it's just a little mildew." I'm like, "No, it's mold."
And it's this kid, he has really bad headaches, migraines, and seizure activity. He's so tired, he's not able to go to school. He can't really eat. And when he does eat, he throws up. And so, they've done the same stuff where this kid actually even had brain surgery. And
Oh,
it
that makes me
actually,
so sad.
after he came out, his headaches actually got worse. And there's a lot of stuff. This kid had issues with like methylation, so he didn't detoxify, so he gets this anesthesia. His body has a hard time doing that. A lot of times after surgeries, they'll put people on antibiotic to prevent infections. Well, then when you have mold, a lot of times the antibiotics actually can sometimes make the mold actually exacerbate the symptoms, get worse. And I knew the kid had mold based off of, talk and stuff. And I get these lab results today when he's in the office, and I go over it and I'm like, dude, you literally have black mold, ochratoxin A, Stachybotrys. Those are
Oh,
horrible black molds. And the thing that's challenging is now this isn't going to be not an overnight sensation. Now it's a marathon, because and that's what's challenging. Because if you're out there and you're like, look, I went and
yes.
seen the best functional medicine practitioner, I went and seen the best functional neurology guy, I went and seen the best medical doctor, the best acupuncturist, or whatever. Look, those are great practitioners, and I respect every single one of these guys because they all have a job and a duty and their passions to help you out. But sometimes you have to actually look at this whole big picture. And these patients, you can do all the supplements, but if you have primitive reflexes, and why these things are so important is because that means that your brainstem, something is going on in your brainstem. Okay, your brainstem is the most vital part of your brain, and if you have certain reflexes, that can correlate to how well this nerve is called the vagus nerve. So it literally goes from the brainstem and it goes all the way down. And it connects to all your organs. That nerve's job is to help you absorb nutrients and flush stuff out. So if you're done functional medicine, you've taken the best supplements in the world, and you've done the best detoxification systems in the world, and you didn't get better or you didn't recover, then there's something else going on. And that something else is going on is that you need to actually integrate your primitive reflexes or your return reflexes. Or what has to happen is maybe you have like Dr. Robert Malila, who I actually lecture and teach for, and a business partner who wrote an amazing book called Disconnected Kids that every single parent should actually read. He basically talks about this brain imbalance, that these kids, they had these reflexes, they were retained, and because of that, the brain didn't properly develop. So one side actually develops a lot faster and more effectively and efficiently than the other. And it really just goes back to these connections that the brain has, and also blood flow. And so, yeah, the brain could have an issue. Like we've seen what happened even with your daughter. One day we went in there and you can actually stimulate. So the left side of the brain actually helps activate what's called your Th1 pathway. You want to get really, really nerdy, but that's also the stuff that's going to like help fight off infections. That's where you have stuff called interferons, tumor necrosis factor. And then you have the right side of the brain, which is activate your Th2 pathway. That's all your like antibodies, your IgG, IgA, IgM, IgE. And so those also come as barriers to help, control like how well your gut barrier, your lung barrier, your brain barrier, your skin barrier work. So there's a cool thing that sometimes these people can have a brain imbalance. Maybe someone had a head injury on some area and it traumatized an area, and now they developed an autoimmune disease. They got like Hashimoto's and now they're shivering all the time, or they can't lose weight and they eat like a baby rabbit and they start doing sun intoxications and they're like, crap, I don't understand. It's like, no, there's actually something neurologically going on. So I'm gonna get on kind of a rabbit hole, but yeah, so these patients, they have these underlying factors, and that right there, if you're struggling, then you possibly could have maybe a neurological imbalance. The cool thing is if you look at someone's face, For example, look at mine, and you really zoom in, my right pupil is bigger than my left. And then if you look at my crease right here on my face, I got really good muscle tone here, and this side's flat. And then if I stand up, my right shoulder internally rotates, and then you'll see my arm turning, and then my right foot flares out. And that's clearly a right side of a brain imbalance. Those are all these things. Now, as you see, I'm very amped up all the time, but I'm like a super hyperactive kid. So I've been diagnosed with ADHD as a child. I was put on methamphetamines for over 18 years. So this brain is wired like a super fast car.
Did they help?
No.
Okay, because that's the thing. People are like, well, you just need a few pills, and if you get on these prescriptions. But the thing is, you get on them, and I know this because Brooke had raging OCD, which now I realize that she had a strep infection, and that caused inflammation in her brain, and she had rage. And finally, after I went to chiropractors, and we did different exercises to integrate her system, and it was a lady who practiced out of her home. Beautiful, wonderful woman, so supportive, and we didn't get anywhere. And finally she said, I think your daughter has bipolar. And I'm thinking, like, where did that come from? It just made no sense to me. And so she finally was like, I think you should see a psychiatrist. And we put her on SSRIs, and it turned out that they didn't help. But you go and they say, like, well, maybe you're not on the right dose. We need the therapeutic dose. And you keep trying and do this. And so I was just curious if they helped you, because so often that's
this is what happened, is that, so I'm still to this day battling the effects of what happened to me. Is I can't stop. So Dr. Crawford calls me the Terminator, or he calls me the Beast, because what happened is I have so much dopamine in my brain that I developed an addiction, and my addiction is actually, I read. You've been in my office to know. So, I'm a practitioner, but I also have like I think now I'm at my 12th business, about to open up my 13th. I just, what it is it's not for the money by all means, and you know this from working with me. Like, I love people, but because of this, I'm very analytical, and I'm so detail oriented to where I memorize everything, and I read an insane amount of books. Like, I can't stop. My wife tells me all the time, she's like, Kyle, you need to slow down. But it really is just that my brain has been completely rewired, and people who meet me, they literally are like, dude, you're on another level. But I practice what I preach. I eat super clean. You've been in my office when I have team meetings with my staff, and I even break all my staff members, and no matter where you're at in my organization, we're a team. And I also tell everyone that, my job is to give people a platform, and then you create your own roof. My doctors are amazing. My entire staff is so incredible.
They are, and I've been to a lot of places, so I feel like I feel like I work for the Consumer Reports of like the medical field, because I feel like I've been to so many places and dealt with so many different personalities, and your staff is on a whole nother level. And I will never forget one time, we haven't been there for very long, but one morning you came in and you were talking to them about setting goals. And I knew at that moment that, like, this makes me emotional, because when you say you practice what you preach, you really do. You embody that and that lifestyle. And I remember you talking to them about setting goals, and I thought, this guy's the real deal. Like, you elevate people to a different level. It's that saying, when, I don't know, the ship rises, the tide rises, everybody goes up. But that's what you do. You bring everybody up. And I think that your message, the way that you practice, and the way that you want to get this word out, because so many parents and families are struggling right now, and they're not getting answers. And I think that, I feel like you're talking about head injuries. I mean, Brooke fell off her horse, and people were like, oh, I didn't see it. The trainer was there. And they're like, good thing you didn't see it, Mom, because you would have freaked out. But she got up and walked away, and the horse was okay. And then now being in your clinic and seeing all these people with these brain injuries, I'm thinking, like, well, maybe it wasn't okay, And I feel like that's another thing, like mold, that people don't understand. Because what if you get a concussion? What do? You take your kid to the ER, they look at their pupils and they say, okay, wake your kid up every couple hours and just keep an eye on them. And so you don't know because we're not taught how to heal the body. But you have figured this out, and it's incredible.
So this is the one thing, people found me because of John Grant. And, I was doing my thing in Southwest Louisiana for a long period of time. But, I've had everything where I've had ADHD. I was on the medication. I had allergies. I had the albuterol pump and the daily allergy shot. And I literally self-educated myself to learn about nutrition and potential food sensitivities and how those can have an impact, and then even vitamins. And then I turn around and then I have a head injury in 2013 that left me with dysautonomia, where I was so nauseated, I threw up all the time. I had uncontrollable anxiety issues. That led me into really bad digestive issues where literally I couldn't eat certain things, and coming to find out I had a gluten sensitivity that I didn't think that I had before, but evidently after my head injury. And then I turn around, then I get a mold infection. And, it was interesting. My mold thing, I was pressure washing. I'm obsessed with getting my stuff clean. So I literally go outside, I buy a pressure washer. I clean my entire house, my columns. I live in Southwest Louisiana, so there's mold everywhere. So I literally went and I pressure washed the fence. Do you know how much mold is actually on that fence? And so what happened is I pressure washed.
And it splashes. It's all over.
But no mask. Then I turn around and I pressure wash all of my concrete. And I have no mask on. And then I ended up buying another house, and at the same time, I go and I pressure wash that whole house, which is a lot bigger than my other one. I pressure washed all the brick, the columns, the cement, the outside the pool, the fence line, and I got super sick. And I'm pretty, smart guy, but it just blew my mind that when I reflect back, because my mold score was so high that holy smokes, people are out there just pressure washing their fences and their house and the concrete, and they're not wearing anything protective to actually prevent them from doing this. And they don't realize they could have a spontaneous seizure, literally, and they're like, we don't know what happened. And it was actually an over-toxic load of mold. Or that could have set them off to be able to have literally start getting migraines or even potentially an autoimmune disease. Infertility, you're out there and you're listening and you're trying to conceive. Infertility, it's huge that you could have mold, and it's very, very important that if you're listening to this and you're trying to have children, you and your spouse definitely, I highly recommend getting tested for a mycotoxin exposure. Just get a urine sample and see if you both have mold, because if you do have mold and you conceive, there's research that actually shows that mycotoxins, especially ochratoxin A, can actually cross the lactate and actually when you're literally breastfeeding. And so your infant, if you have a genetic issue or maybe an autoimmune disease and you're literally breastfeeding your child and you could be passing, mold or mycotoxins to your child, well, guess what happens to mold? Or actually mold, milk. Milk actually turns into a sugar, and so sugar feeds mold, and so now your child starts getting inner ear infections or developmental delays or eczema or starts having seizures. And I had a poor little girl that came out of my office last week, and I did an evaluation before that, found out she actually had mold exposure, and she's under a year old. And it's this is just blowing my mind that these kids are being exposed to mold at an early age, and that's actually one of the contributing factors to seizures. And if you can get that level, that toxic level down, then now you're taking stress off of the brain, the body's self-healing. And I see this every day. And so to me, it's so, when I get challenged all the time, I'm like, I respect being challenged because it's my chance to educate someone who's in disbelief. And so if you're in my office, you literally would cry every single day to see the patients that I deal with. And just what happened to your daughter. So Katie's daughter, Brooke, she literally was living in my clinic, literally 24 hours a day living in my clinic.
Sleeping in your clinic. Yes, we were living, and I had a suitcase in my car, and yes, we were living there.
So one of my business partners actually has a bed company, and I've called him on 3 occasions and said, hey, Chad, I need you to do me a favor. And he's like, I'll do anything. What you got, man? And I'm like, can you deliver a bed to my clinic? And he's like, yeah. And, we're delivering beds to our clinic for patients because they have CRPS or they have, paralysis or this uncontrollable, undiagnosed pain, which is typically probably either RSD or CRPS. But then that's the diagnosis, but there's something underneath, and it's typically a chain reaction. It's like mold, it's parasites, it's
pain is a symptom. That is the thing that makes me so furious, is pain is a symptom. It's not a diagnosis. So if you have fibromyalgia or whatever kind of pain that you have, it is a symptom of something. It is the alarm bells going off in your body, and people are like, well, I'm just going to get these infusions and, it'll be fine. You're disabling the alarm. And so what's going to happen to them down the road, Dr. Kyle?
Yeah, I mean, they're going to eventually end up where they're going to potentially be bedridden, or they're going to have an autoimmune disease that's so bad that it's actually weakening their muscles, or they can't even physically open up their hands to be able to, open the door or to even feed themselves. Or these people eventually start getting like the nasty C word, or they'll just get to where maybe, one of the things that's interesting about mold, do you know that 50% of actually mold exposure, and I might be off this, might even be higher than that, mold exposure patients actually end up in divorce?
No, but I've heard that you're more likely to be a hoarder if you're in mold.
Yeah.
Because you hoard, mold will feed on the dust and papers and things. It's a food source for it. And so I've heard that people are hoarders. And so and especially the kid that will never leave the basement, usually is a mold thing. It is, and then you don't want to leave your home. And so it's like that mold's keeping you there prisoner.
Well, the thing is with mold too, you start seeing this is a wild story about this one patient that I got. So this guy years ago came to see me, and he was a CPA. And I feel like I'm really good at, from a diagnostic standpoint, that's pretty much a big skill set that I have. And so I'm talking to this guy, and he tells me, he says, first of all, I still can't believe I'm actually here to see a chiropractor. And, that's pretty common. I get that all the time. And to me, it's kind of it's comical because I'm
you have no street cred.
Yeah, I don't.
Except for the crazy crowd.
Yeah. Hey, I enjoyed the crazy crowd and the rodeo people. And so this guy comes in, and I ask him questions, and he tells me that he's a CPA. He spends all of his time in front of a computer, and he started getting lots of fatigue issues. So what he did is he actually put sunshades on his whole entire house. His whole entire house. He had no windows. And so I asked him, so how much light do you get? He's like, none. He goes, besides, when I wake up in the morning, I get in my car, I drive to work, and then I go eat, and then I bring my lunchbox, and I eat in the office, and then I finish up at 5:30, and I just drive home, and then I go back into my home. And I'm like, so you don't walk around, you don't do nails? No, that's pretty much what I do all day long. And again, most of these guys who do it CPA and numbers, if you really look at them and you look at their face, you actually see them look kind of like me. The right pupil's really big. The right side of their face is actually going to be flat. Their arm's going to be internally rotated like that. They're going to have a right head tilt. That person is the guy that's going to want to manage your money because he knows numbers like crazy.
Thank you for that tip. Yeah, I'll be interviewing.
That is. You want to look for a really good financial advisor. Look at somebody kind of like me with my facial features, really good at numbers. So I asked him, I'm like, well, look, that this might sound kind of crazy, but it's in my book too. I wrote about this, and it was about sunlight, that natural sunlight actually reestablishes your circadian rhythm. And, now we're being exposed to so much screen time, and we want to know why some people have sleep issues. Well, yes. I tell this guy this, and he's literally crunching numbers all day, looking at his cell phone, and he gets home and watches Netflix. And he gets no light, no exercise, and he's in a dark environment. Well, first of all, guess what happened in that dark environment? There's no light, so he's going to have mold. It's dark. It's going to be humid. He turned around. I told him, I said, I want you to start watching the sunrises and sunsets. And he's like, laughed at me, goes, now I know you're crazy. And I'm like,
it's a legit thing, though.
I mean,
it sets your body. It gets your brain awake. It gets
regulates
your body.
The way I work and operate is that there's a foundational principle of how you should live your life. You should watch the sunrise and the sunset. You should eat good, super clean food, real food. God actually literally made someone put a seed in the ground and it created a real food. You should eat real food. You should drink, good quality water. You should exercise. You should be grateful the fact that you woke up, because a lot of people don't even wake up. You should be grateful for every sense that you have. If you can see, thank God for that. Yes. If you can hear, thank God. If you can actually talk, thank God. If you can move your arms, thank God. People should be grateful for what you have, because there's people out there that don't have what you have. And you should watch the sunset, and you should literally just live life and be grateful. That's pretty much it. And people don't do that. We're so distracted. We're in this fast-paced environment to where
we have a plan, right? We have a plan, and sometimes we're achieving things and we don't stop and think about small things. But you're talking about people being grateful for this. It took for me having a kid who is so disabled that I can take those. I can be thankful for those things. You don't know what it's like to unless you have a kid who you cannot buy a gift for. You see a lot of really sick patients, but I realized when you're the parent of a chronically ill child, there comes a point in my life where I realized I could not buy a gift for Brooke because she was so incapacitated. She can't see, she can't listen, she can't sit up, she can't do any of these things. And at that moment, I realized that no amount of stuff for achieving goals matters, because if you don't have your health, you have nothing. And if you don't go outside and you don't move your body and you're not breathing fresh air, eating real food, and you're hurrying, right? You're hurrying for this, for what? For what?
Yeah.
Nothing.
So, two things with this. This guy, this CPA guy, he actually literally, I told him to come back and see me in 2 weeks, and he did exactly what I said to do, but he probably just, probably didn't eat the right things, but he did watch sunrises and sunset, and guess what happened? It reestablished his circadian rhythm, and he goes back to start sleeping. So he tells me, I have all these sleep studies. He goes to his sleep doctor and goes, hey, why didn't you actually, first of all, I went to go see this chiropractor, and now I'm sleeping, and I don't need the medication anymore, but do you know he said that I should watch the sunrise and sunset to recalibrate my circadian rhythms? And the guy was like, yeah, it makes sense. He's like, why didn't you freaking tell me that? I've literally been coming to see you. But what happened is I told the dude too, take off your sunshades, go get some sunlight. That was a basic thing. So, for me, I'm like, this is not rocket scientist. I'm just literally just thinking about how you should live.
Think about people before electricity in our homes, right? People went to bed early because it got dark and you had to shut down and stop. But if you don't, but now we have artificial lights. So, right, you don't need the sun. You don't need that. You just turn on your lights, get in front of your screens. And
that's it. This is something you mentioned about a gift, about buying someone a gift. And this is a little emotional. If you're listening to this, tell you one thing about me, which is really amazing, is that I actually have people that literally, because they had such a huge impact and we changed their life, that they literally donate to our clinic. And they donate because they know that there's people out there that have literally spent hundreds of thousands of dollars. And they donate to these people that could potentially come in who can't afford care. And, we do everything we can to help people out. But I got this one girl which I'm so grateful for Instagram, because, I get all these people from all over. But I got this patient that came in one time, and she's coming from Arkansas, and she comes in and she says, Dr. Daigle, this is my birthday gift. And I'm like, your birthday gift? She's like, yeah, my birthday gift was for my parents to actually take me to come see you. And I'm like,
oh, that really...
No, it just, so I have a daughter, and it literally just pierced my heart, because I'm trying to hold it together, because I'm like, if my daughter had issues, and I would literally sell my kidney.
Yes.
And that girl, when she told me that, I tried to hold it together, and I walked outside. I'm like, God, first of all, thank you for giving me this girl, because I know that you're going to literally give this girl the best birthday gift that she's ever gotten, so we're going to give her life back. But this is just challenging to see that, these people, they've been hurting, and they don't know what's going on. And what happened is that we literally found out this girl, she had mold.
No.
And she also had retained primitive reflexes. And it was amazing that I was actually able to change this girl's life by teaching the parents about proper diet, nutrition. Like, you got to make sure that you go on a low carb diet. You got to start drinking a lot of water. I also make sure that every single parent puts an air purifier in their child's room so they have good air quality control when they're sleeping. There's something I like to use, it's called iWave. You put into your air vent that actually helps with reducing the amount of mold particles. It's very important if you're listening and you're a dad, and you should literally change your air filters every 3 months or 1 month, and you need to make sure that you actually get that allergen filter so that way you get rid of the mold. It's very important that when your child takes a shower or a bath, that you literally get like a dehumidifier to actually suck up all the moisture, or literally wipe down the countertops and even the air vents, because mold can actually start to grow in that because of the condensation that gets stuck inside of there. You should really, 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 really watch, like if you look at your dishwasher and you pull it out and there's a little, it's not airtight, you might notice black mold. That's not normal. You need to make sure that that stuff gets away. You also might notice in your bathroom, you could potentially start having caulk that starts getting out and water seeps inside and you start getting mold. Or if you have carpet and you're literally getting wet from taking a shower and you walk into your bedroom or walk throughout your house and you don't have a dehumidifier to actually literally suck up, absorb all this humidity, mold can actually start to grow inside of that. If your home has a huge roof and you don't have proper downspouts, you could literally get water that could actually start seeping up and actually getting in cracks. Your window sills can literally start to actually accumulate water damage that could actually turn into mold. If you literally buy some old furniture, for example, a bed, and this thing's like an antique bed, or you start looking at, you purchase an old book, old books could have mold on it.
Everything old. I loved to buy, like, we had a farmhouse, and so I like farmhouse style, and I loved to get furniture from the thrift store, consignment store. Like, that was my jam. I loved it. I painted, and I know there's a lot of like women out there who love to do that, but I had no idea that these things, they smell musty. So if things smell musty, that means that they have something growing in them, because that is the off-gassing from mold, and people don't know that. So it makes me sad still. I'm like, it's a no-go to get that secondhand furniture and buy those old things, all those things. And I love thrifting. Like, my sister has that's a hobby of hers. It's like getting old stuff, and now I'm like, yeah, no thanks.
Yep.
But it's in everything. In home maintenance, I feel like after going through this, I learned really, it's about maintaining your home. And I feel like people were busy and we just think, oh, that's not very important, like changing your air filters and, and checking the caulking and all of that.